go gentle. I got you. It's okay. There you go, a little more. Yay, a little bit more. You thought I wasn't going to get it, but I did. Can't have you traveling this far without getting a good wallop. Gee. All right, Lindsay. Wow, you came all the way from England to see me today. You said you've been to or at least a chiropractor who's worked on you a little bit, but sort of not near you anymore. Tell me about yourself and tell me what's going on, what you're feeling. You're a bakery manager?
Yeah, my work, all from being young, I've always done the same like repetitive movements, and the doctor said back in 2009 that it was repetitive strain injury and to change my job.
Okay.
But it was a bit difficult because it's my dad's business, so I like my job and where I am. And doing that same motion, she said that she thinks that's what's caused, the same sort of like pain in the arm area.
So it starts in the shoulder and then goes all the way down?
Yeah, I get like it aches all into this area. The elbows become more worse over the years, and they said that it originated from my neck when I spoke to the chiropractors.
Very good.
And then in the years that I've had it, this side has done the same now.
Okay.
And it's exactly the same.
Yeah. Has any imaging been taken, x-rays or MRIs? Did anybody take any imaging when you were home?
We had an x-ray done, didn't we, from the guy in Doncaster? What did that say on them? Nothing.
Just of your neck?
Yeah, that's right, yeah. Just of the neck.
The difficulty with taking an x-ray at a young enough age, below really the age of 65 or definitely before 55, is that the discs are these pieces of cartilage in here that are made of water. They have no feeling, and they're invisible on x-ray.
Right.
So we can have injury to our discs and it not be seen on x-ray. In fact, I've actually seen many x-rays where a disc is actually swollen, and I know it's swollen because I have an MRI of the person on the same day that the x-ray was taken, and we can see an injured disc on MRI, but then you look at the x-ray of the exact same area and it doesn't look like anything at all.
Right.
So it's unfortunate when we take x-rays that sometimes as patients you're like, well, I x-ray came back fine, when in fact the symptoms that you're describing are symptoms of nerve pressure. So the wires that, for instance, in the lower back, these go down your leg, and then the nerves in your lower neck go down into your shoulder and down your arm. The repetitive stresses are ones that are affecting your lower neck. So when we move our body around, if we don't have the right posture, if we don't have the whole spine working as a team, very commonly we overstress the lower neck at a high rate. The upper neck is designed to be the main engine, so this is where most of the work should be happening when we move our head around. But if this area gets stiff, the lower neck gets unlocked and we end up overstressing this. The curve in the neck is vital for making sure the upper neck works. And this is where, I can only imagine the posture, you've been out of forward posture. And that forward posture from a young age, even maybe before you were working in school and years here in America, everybody's from 5 to 20 were sitting for, I've talked to teenagers right now, something like 14 hours a day or more. People are rounding forward with the iPhones. It's getting worse, and everyone's as huddled forward as possible. So that curve isn't valued. Our world doesn't guide us in posture. The posture of your upper back is putting a lot of stress right on your lower neck. And the lower neck stresses what's going down our arms. We want to do two things today. We're going to loosen up your upper back. So very, very commonly, the areas adjacent to the lower neck are not working properly. That's what allows the lower neck to be overstressed. So the upper neck, the upper back, and we're going to take the stress off that lower neck. All right, you're fine. Stay right there. You're fine. Shoulders actually not too unlevel. You're just your body's forward. I don't have too much shoulder or head tilt or even head translation. It's really just your body's forward. Sometimes people will come in. They'll have, if you have an injury on one side, and this kind of makes sense to me that you're saying it's both arms, because if it was just one arm, there'd be more of a lateral misalignment. I don't see too much lateral. It's really just forward posture. And like I said earlier, the back side of your spine having a lot of feeling presents the difficulty. So because the back side has all the feeling, as I bring your body upright, you understand, and it doesn't feel good back there. And we want to, try to do it in almost like orthodontistry. We don't just change someone's teeth in a month. You spend time over a period of years to change the posture, and we'll do it slowly and try to make it not so. If you turn your neck or left or right, is there any pain? So go ahead and turn your left. Is there pain?
Just aches a little bit, that's all.
On the right side?
Yeah.
Okay, go ahead and turn your head right. How about that?
Just pulling a bit on my neck.
Pulls on the left.
So, yeah.
Okay, and then just look up for me. Is there pain when you do that?
Just aches a tiny bit in my right shoulder blade. Just at the bottom and that.
Kind of in here?
Yeah, that's
Okay.
right, yeah.
Okay, when you bring your head back, the joints get inflamed. So we're compressing joints, and if those joints are inflamed, you're gonna feel them. The joints in your lower neck, and that's what this poster here shows, the joints in the lower neck will give you pain. Right now, where you were saying, Ed, it's down here.
Yeah, that's right.
So we call this referral pain referral. So the irritation of the joints in the neck cause pain in areas distant. Okay, so what that means is you bring your head back, you're compressing the joints in your lower neck, right? So remember I showed you that this takes the weight off the joint, puts it on the disc, bringing the head back, compresses the joints. Those joints, because they're inflamed, will then give you pain here. And the question is, well, why is that joint inflamed? Well, the posture and the mobility. So certain joints, almost like certain teeth, you're always chewing on the same teeth. And we have a lot of other teeth in your mouth that aren't injured, and we have to learn how to bend and use those more effectively. Okay. I'm going to help you do a little sit-up. Take one deep breath in for me. Let all the air out. Let it go. Good. Okay, you did good. Deep breath in. Let it go. Exhale. Relax your jaw. Relax your jaw. Good. Deep breath in. One more. All right, one more. Exhale. They're moving. You did good. You can stay right there. Have you stay right there. I've seen way worse. I've seen people where I go to adjust their upper back and I get like a 2-year-old, arms folded. I don't want to move, right? I didn't have that. They were reluctant, but they did function. It's okay. The only thing that really causes that symptom is nerve pressure in the lower neck, and you're validating it also with bringing your head back and feeling that pain in your shoulder blade. That kind of validates it. So not only is the disc upset, but the joint's upset. They're both going to be upset at the same level, and that's common. I'm not going to hurt you. A little traction, just open this up a little bit. There you go. You're doing great. I got you. Real gentle. It's okay. It's okay. There you go. That's it. Yeah. No big deal, right? Piece of cake. I got you. Yeah. There you go. Relax here. It's okay. Did great. My poor analogy is that nobody likes a peanut butter and jelly sandwich where all the peanut butter's in one clump, right? So you spread it over the entire area, right? I imagine if you made a cake and you just dumped the icing in one spot, right? It's not a very good cake. You want to spread it over the whole area. And that's what I find as a chiropractor. All the stress is in one spot. In the same way that it was stretching and spending a lot of time rounded forward took you out of the right alignment, it's the opposite stretching which is going to bring you back into the right alignment. And so in some sense, I don't really treat symptoms, I treat posture. I believe that when you're in the right alignment, in the right posture, that the stresses are evenly spread, no one area is overstressed, and therefore you don't have symptoms like, radiating symptoms down your arms. That is an effect of your lower neck asking for help. It's a cry for help. That you have one area doing 4 times, 5 times what it's meant to do, and so it rightfully is very upset about it. If you had to do all the work in your bakery, and no one was there to help you, you kind of would be rightfully and justly upset.
Yep.
Where's my help?
Yep.
And so that's all this is really to me. It's not, you don't have a disease, okay? People are very quick in America, at least, to throw around this degenerative joint disease, osteoarthritis. Okay, these are terms that we, doctors can use to, say that you have a disease in your lower neck. They call the growth of a bone a disease. That if you overstress the joint will get larger, and that's a disease. And I say, well, if that's a disease, then a callus on your skin is a disease, and a muscle getting bigger is a disease. They're not diseases. I disagree with that as strongly as possible. I disagree with that narrative. I understand what they're getting at, but it is not a disease for a joint to grow. It's an adaptation. joints adapt to stress and get bigger purposefully, intelligently. Your body grew those joints. And my dad, since I was a teenager, has taught me to target and care for the stiffest parts of your spine. And right now, in terms of your neck, right there, feel that?
Yep.
It's not correct.
No.
That's not huge. It's not the. I wouldn't say it's a very. It might be easily missed by practitioners because it's not a Frankenstein bolt. It's not a huge knot that I've had some patients in here where it's like, oh my gosh, how has nobody ever seen this?
Yeah.
It's not, grade 4. It's a small little, but there's an injury right here, and it will make you want to get away from it. Your body says, no, let's tilt the weight to the right. Kind of like hair, it gets tangled. If you don't, I didn't do anything and my hair got tangled kind of idea. There's muscle fibers, very similar to hair fibers in here, and so when we have injuries, they can get tangled up, and then because of that, they don't stretch very well. And you can sort of see, you'll see it later, but this little mark right there.
Yep.
This is with the gua sha. They use this tool as a way to untangle, like a comb to your hair, to untangle the fibers inside.
Okay.
Doing great. Big difference over here. See how smooth it is over here?
Yeah.
The right side is
Well, that's
right. It does not have the knot that left upper side. And when we're stretching at the end of your visit, I'm going to show you, we're actually going to put a little more pressure on that left side to sort of like a drawer. If a drawer is crooked on one side, right, you want to put more pressure on the more open part of the drawer to get the drawer to level out. And then we shut the drawer evenly. You're doing great. This is the channel down here, so we're going to try to push that rib down. I know that's sore. Yeah.
That's what it makes as well.
Yeah, we're going to push those ribs down. The more Googleable diagnosis is what we call thoracic outlet syndrome, is what we would call this in America. This is a thoracic outlet syndrome. There's a channel where the brachial plexus, the nerves that go down your arm, have to funnel through this little channel here. It's like the movie 300 with the Spartans. They all getting funneled through this little channel, okay? And so it is an anatomical bottleneck, okay? And there's nothing, or at least I haven't heard of, read anything of anybody trying to do anything about the bottleneck. Nobody's talking about, well, at least in any level of commonality. Let's remove your ribs. You understand? Let's remove the upper rib here so this channel is more wide open. It's made up of 3 components to fix it. One, we got to get the rib in your upper back down. This channel that the nerves are sitting in cleaned, meaning not sore and filled with lactic acid. And then the bones in the neck in, which is the curve in the neck, and getting that arch back in your neck. And those are the 3 components to alleviating stress on the thoracic outlet. So we got to get that right there. Push it down. All right. I would hope that, yes, trying to get this soreness out of here. Now, why is it sore? Well, your work and your posture, right? So to some degree, working in the profession you have chosen, there's going to be a level of cleanup that's going to be required. Well, Ed, it's back again. Correct. You're going to need a level of continual care to do the job, to be in the position that your job necessitates. Ed, I can't do my job like this. I have to bend forward. So, okay, I'll see you next week. It's. I have dentists that come and see me. I have hairstylists, and the posture that those jobs does require more care than somebody that's not doing a job that is so forward. And it's just, that combined with how much care we had since we were kids, and it's kind of a build-up.
I have been delivering a lot, in a van as well.
Okay.
So I've been delivering, which is like early mornings. So I've been trying to put my posture straight in the van while I'm driving.
Gotcha.
Yeah, just to keep it, all together, and looking forward and keeping my shoulders down.
Excellent. I just like the way you said mornings, morning.
Really early morning.
I know the way our accent difference.
Yeah.
Morning. Might sound so boring. Morning.
I think yours is real good.
Oh, okay. Interesting.
Yeah, I like it.
You like the American.
I think ours is boring.
So you don't think it's anything to do with fascia? Do you know when if you've got a chicken breast and it's in like this sort of a skin, is it something to do with those all being stuck together and not being able to move freely?
In here, it'd be in your neck.
In my neck?
Yeah.
Not in my arm?
Yeah, the arm, the problem is your symptoms are too broad, okay?
Right.
If it was, Ed, I have pain right there.
Yeah.
Or Ed, I have pain right there.
Yeah.
Right? But you went, Ed, it
All
hurts.
down.
It hurts here.
Yeah.
All down.
It's just the whole,
Yeah, all the way up.
right?
This-
That's
yeah.
That's doctoring 101. I'm going to work on your arm. I'm going to work on your arm. I'll work on your arm in a second, but no.
It's from the neck.
Yes,
yeah.
ma'am.
Yeah.
The symptom is too broad.
Right.
You're going over multiple fascia layers. Unless you've injured all of, it's really unlikely that you've
Yeah, all of them together.
injured that much of that area. I mean, it's possible. I'm the betting man on what is the most common
Yeah.
cause, and based on your posture. Now, if your neck to shoulder posture was correct, I would be more confused. I'd say maybe you did. Maybe there is some just tendinitis, inflammation of the arm. And when the neck is upset, it will cause tendinitis in the arm. So this is where it gets wrapped together. That when it's like a plant with no sunlight, right? The plant isn't going to be healthy if it's not getting sunlight. The nerve in your neck supplies the sunlight to your arm.
Right.
So this is where I think doctors can get off road and get sidetracked because they'll say, oh no, she does have some inflammation in her arm. And it's like, well, yeah, but it's because the nerve isn't happy in the neck.
Right.
When we're pinching the nerves, this is maybe 5 years ago or 10 years ago, your body said, there we go, all better,
Yep.
right? It just rounded your shoulders forward. That bought you time. You would have been here earlier kind of idea. Now with the shoulder rounding forward, now the shoulder joint gets inflamed. So you will, because now the shoulder should be in the middle. When you round your shoulder forward, you're no longer in the center part of the shoulder cup. And so now, well, Ed, I have a labral tear and I have a rotator cuff tear in my shoulder. Well, correct, because your neck, the nerve was being pinched in your neck, your shoulder then went forward, and now we do have a shoulder problem. But again, it's still all secondary to fixing the neck problem, which caused the shoulder to round forward. But this will cause pec tightness, inflammation of the AC joint, labral pressure. So labrum is the lip or the edge of the cartilage. There's not much there to begin with, even when we're young. So people will get all up in arms. Well, she has a labral tear in her shoulder. Well, she shouldn't be pivoting her humerus there in the first place. We should be working on getting her shoulder back, off the lip, off the labrum, and then maybe it'll feel better, right? So to answer your question about the fascia, yeah, the fascia in here will get upset, but it's all still based on the posture and the compensation that your body has done as a result of nerve pressure. It always begins as nerve pressure first. How's that?
That's okay.
Yeah. This is the most common spot right here. It's called lateral epicondylitis. So this is an attachment point right here. Okay? And I've had people where I do this and they,
Yeah,
You know,
that's this arm.
okay, well,
That's, yeah.
and the health of this comes from that nerve.
Right.
So what happens is if the nerve is like the sunlight to the plant, right? So, well, no, Dr. Ed, the plant is withering. Yeah, okay, yeah, but it's not because the plant is diseased. It's not getting what it needs nutritionally. The nerve supplies the power, like to your oven. If you don't have it plugged in, no matter how much good materials you have, you can't bake properly without electricity or whatever, gas or whatever. The point is that you have to have the power, and the nerve supplies the power to the arm. And if there was a real big fascial problem, this would get real dark real quick. You'd have a lot more marks on the arm if there was a lot of tangles in here.
Right.
What's your favorite thing to bake? What's your
I don't mind doing the scones.
Scones, my
Yeah,
favourite.
do fruit
Oh.
scones and cherry scones.
Oh, scones.
Yeah, I know a lot of people at work don't like doing them because it takes time.
Okay.
But I like to make them look nice because we sell them on like a market stall.
Okay.
So if the customer sees them looking good, then they buy
Yes.
them. If they look maybe not as good, they won't want them willy. So
Do you ever make any pumpkin scones?
no, never.
No? Okay, I
My
was
dad used to do
just curious if it's a
date
book.
scones,
Okay.
from years ago.
Okay.
He did date scones.
Okay.
I don't really like dates, but
Probably-
my nanny used to like them.
Probably an abomination of a scone. It's the scone that I like the most here.
My fingers tingle a little, when you're pressing that.
Yeah.
Just at the tips.
Good to know. Okay. Yeah, we
Mhm.
got Here's some
A bit
information
like
here.
cold and a bit tingly.
Okay.
Yeah.
Yeah, there's a little sore there. A little
Yeah,
bit.
it usually is sore around my elbow. Yeah.
You want to compress this. This
When you
needs,
press it all the time.
it needs some care.
Ease it.
This is just from using our muscles. The extensor muscles in our forearm attach right here.
Right.
So, using your arms a lot, working in repetitive, these attachments get inflamed. They need some pressure. You need to try to, I'll do it, I'll take my own and I'll
Yeah,
just sit
and
there
press
and
it yourself.
find a
Yeah.
spot. Maybe
And then
even
that
ice
side
it.
hurts because you're pressing that, you try and alternate it.
If you can, you want to, I find that the attachments themselves need care. They don't self-resolve very well.
Right.
Ed, I don't feel like it's getting better. And this is a common one that needs care. I don't do any transfriction. You don't rub over it. You just sort of find the spot and hold.
Press.
You're just trying to compress, almost like a panini press. You're just trying to smash the sandwich together.
It's really tight there.
Yeah. So these are the muscles that attach there. So when these muscles get tight here, they keep a constant pull on that attachment. So I would massage this towards the elbow.
Right, okay.
So you're trying to take this and trying to approximate or close the wound. Massage it that direction. And then on the attachment, you just hold. So
Right.
hold that and then you massage
Okay.
this. What you're asking your muscles to do all day long is, the level of stress. It's these, like an oven or like a machine, it needs maintenance. It's like it needs some oil, some lubrication, some blood flow.
Right.
When an area gets tight, now part of this is that who controls this muscle? Well, the lower neck.
Right.
So sometimes the muscles in your forearm will get tight, and it's not so much because of what you're doing throughout your work, but simply because there's pressure on the nerve in
From
your
a
neck.
posture.
And so that can make this get tight, and then it cause the elbow to hurt.
Right.
And so if my father was in the room, he would still say, it's all your neck.
Right.
He would just go back to fixing the neck is still the penultimate thing that has to happen first. Now, I think you can work on both, and I think they both join together and work together well. But this is why you'll get varying opinions, and you'll have the extreme opinion, which is just it's all your neck.
Right.
Because, and I do agree with that, the tightness here, a percentage of it is still due to your neck. So working that, getting that soreness out of there.
So when we're sat at home, just like later on after work and we're sat chilling out,
Right.
and we have a recliner sofa.
Yeah.
Is that okay in your eyes to? Oh, you're not supposed to be laid
Right.
that way,
No,
because
no,
of
it's
your
not
posture
good.
again.
It's not good because you almost become molded to whatever shape that recliner.
Right. So we need to be up more straight.
And if you think about it, if all of a sudden you're no longer a baker, now you're the CEO of the company that makes those recliners, how would you sell a lot of them? By making them more comfortable or less comfortable,
more
right?
comfortable.
And comfort's based on feeling.
Right.
So I told you earlier that the front side of the spine has no feeling. We can't feel when we put stress on those discs.
Right.
And so it's comfortable to
lay back.
right.
Right.
But that doesn't mean we're not stressing out a part of our body.
Right.
And that's deceiving. It's hard to connect with what I'm saying, and it's hard to, well, Ed, the things you're showing me are not comfortable.
Mhm.
But when we're putting the body back, we're taking weight off the disc, and the disc is the foundation for every surgery. Almost
Right.
every surgery at its core happens because of disc injury.
Right.
That because the disc is injured, that now we're running out of tread. Okay. Just gonna see if I can get a little bit more. Real gentle, I got you. It's okay. There you go, a little more. Yay, a little bit more. You thought I wasn't going to get it, but I did. I turned into a little leprechaun. There we go, I got you. Beautiful, beautiful. All right, wonderful. Right there. Right there. We can't reshape hard clay. Right? We can't reshape hard metal. We have to heat up the metal, right, like in a furnace, or heat up the clay, make it malleable, make it soft. And that's the first phase of posture change, is really not really posture change, it's all prep, right? I imagine even with making a cake, right? It's all about prep. You got to prep everything, get everything ready, and then you make your product. But it's like this is prep. We have to prep your spine prepare it for the stretching, which is really what does it, and what allows the mechanical change to last. One of the things people run into is, Ed, I felt better, but then my body seemed to want to go back to old habits. And you're right. This is we're late to the party. We're late to the changing of a habit that you've done and performed for decades. Now we're going to take away. No more scones for you. Well, I like my scones. No more. Right. So it's like we have to create new habits, right? And that's the journey is one of unlocking the spine and then teaching you how to keep it unlocked, right? And then that's accomplished. I'll show you in a minute. We'll show you some neck stretching and back stretching.
Okay.
Yes, there we go. All of this has so much feeling, obviously. When I feel it all. Ed. All these knuckles back here are loaded with pain fibers, and so we can. Now they shouldn't hurt. They become hurt because their stability goes down based on the posture you're in. So when we're rounded forward, they're not very stable, and so they get more swollen. They get inflamed. Some joints aren't working at all, so they clean themselves through mobility. So when these areas become frozen, they actually fill up with lactic acid. Like they're not getting the lubrication they need. Okay. You okay?
Yeah, we're
Okay.
okay.
All right. If I'm going too hard, please let me know. I'm a very greedy chiropractor, but I don't need to. Can't have you traveling this far without getting a good wallop. Gee. All right. I love all the words. The loo, the bonnet, the boot.
Well, the lady, the Uber driver, she said, "Oh, do you mind if we stop? Well, do you mind if we stop at the gas station?"
Right.
And we call it petrol station.
Petrol, right,
Yeah.
right.
So it's gas station.
Some quid. Quid.
I took some nice pictures last night when we went to a Brazilian steakhouse.
Oh, yeah.
Yeah, afterwards we came out and all the sky was all pink.
Uh-huh.
And it was real pretty, so I put it on Facebook and everyone was liking it, because saying, "Where you at? Where are you?" I said, "Just outside the hotel, Mum."
Just needs care in here. He's got to work these ribs down. Yep, all that kind of downwards if you can. Try to guide at home, holding, try to push this direction. Yeah, working those downwards. There you go. This has to go down in order for your head to come back. We have to create like a pocket, or a space for the head to come back into. This all has to go in. All of the marks act as a nerve irritant. The tissue holds on to the lactic acid. The nerve passes through that tissue, and so if the tissue has lactic acid in it, then the nerve is what we call sensitized. It's going to be, Ed, I didn't do anything and it starts hurting, or I turn my neck and it starts hurting. Right, the nerve is right by the cliff edge. It's right by its what we call firing point or action potential. And so this is what I call desensitizing. We're trying to clean the spine, bring the nerves away from the cliff edge, and again, we just don't have any. There's almost zero spinal care. It's all just wait till it goes and do an injection, right? Cortisone shots and nerve ablations. They cook the nerve. They, just damage the nerve. Like somehow the check engine light's the problem. That's a call to action. Your body's trying to alert you to a problem, and we, deactivate it. Okay, but this is all doing good. this right scapula here, a lot.
Yeah,
a
that's
lot in
right.
here.
That's the originating on.
Yep,
Yeah,
yep.
always this right side.
There's more. There's more on this side. If you don't fix the root cause, then it just gets dirty again quickly.
Yeah.
And that's again the posture. You know, it's we're like in a kitchen. It's not a problem that there's a mess. It's the lack of cleaning up that was the problem. It was the lack of anybody teaching us that we needed to clean up before we left to go home. The lack of cleanup is lack of care. In a minute, I'm going to show you when we're stretching, we're going to bring our shoulders back and try to stretch back. Injuries back here make it difficult to bring your shoulder back because you start to compress all the things on the backside that have been injured over the years. And so, again, sometimes care in here will make this area not so sore, therefore you can stretch your shoulder back, along with the fact of this channel needing to be opened up so that we can do it without pinching a nerve. Okay.
Okay.
Doing great though. I know it's sore. Oh, not the butt. Anything but the butt. I know. Gotta work the butt. There we go. I know. There you go. Right there. Yep. I know. Not that spot. No. There you go. You okay? There you go. Perfect. You're ready. Let's get a little bit of dance. Breathe for me. Relax your shoulder. Uh-huh. Twist. Try to twist. I got you. There you go. There you go. Uh-huh. Good. Other side for me. Uh-huh. You did good. Uh-huh.
Click straight away, didn't it?
You did good. Good. Let's go on your back for me. There we go. Yeah, you're on your toes all day. Yeah. Gotta get these. When we're on our toes all the time, they get jammed. Yeah. Yeah. Okay. Ow. Whew. Okay. Yeah. Yeah. The correction is to work on stretching the top of the foot. The toes are starting, especially this guy, starting to go upwards, right? We want to, it's okay. The health care is to work on, pulling the toe and trying to stretch. You almost put the foot on the ground. You want to curl the toes. That makes sense.
Yeah.
And you want to stretch this top part. Symptoms like bunions, drop metatarsals, heel spurs, plantar fasciitis, shin splints. Those are all to me one problem of too much weight on the toes for too long.
Right.
Okay. So the health care is to try to obviously the more forward the head goes, the more the weight goes to your toes,
Yeah.
right? So the head, it's still your neck, like my father would say,
Yeah.
right? So the foot problems are really a domino of the neck, but that doesn't mean we can't do things to try to help foot problems by stretching the foot this direction. Okay, real easy, I got you. Okay, good, good. Oh, yeah. Okay. Yeah, there's way too much stress on this, especially on this right side. Wow. A lot of. Ooh. Uh-huh. There it is. There we go. Okay. I got your ankle. I got you. Good. All right. Go ahead and tilt your head left for me a little bit. Tilt left. A little bit. And then go ahead and tilt left. Tilt left. Okay. No. Go ahead and tilt to the right for me a little bit. And then go ahead and tilt your head to the right. There we go, yeah. Little clicks. So they made a piece of foam that emulates my thumb or my elbow, and it holds you like how I was holding your neck when you were on your back.
Okay.
And the purpose of this is to stretch that curve back in your spine. We know that it takes time. It takes about something like 20 minutes to change the position of the spine. And so it's also easy to get a lot of change quickly, and then it's harder to get to perfection. So it's like a diminishing returns curve. If your head's 2 inches forward, we can get to 1 inch forward in a couple months. It doesn't, and then to get from 1 inch forward to 0 takes much longer. But even just taking your head from 2 to 1 is going to be an immense change in the stress on your arms and your neck and back.
Right.
So to do that, we have to stretch your body back and stretch actually the front part of your neck that has never been stretched open, because predominantly we're always stretching the back side and the front part is always compressed. We could do a little bit of left rotation. So remember that knot was more on the left side of your neck?
Yeah.
And so you could do a little bit, just maybe, I'm just talking about 5 or 10 degrees.
Yep.
The makers
When
of
you can
this,
feel it.
right.
Yeah.
The makers of this don't say to do this. This is something that I've come up with. I think it helps to speed up this process. And I wouldn't do this for more than like a month. I don't want it in the lower neck. The goal is to have it kind of as high as you can, but your head still goes over it. I don't want it down in your lower neck where you're injured.
Yep.
So we want to keep it, its contact is kind of up here.
Yep.
It might slide a little bit down, but the main thing is that we're changing where the folding is happening. Your neck likes to bend and fold in the lower neck. I kind of want it to retrain it to bend in a different place.